since I came on to the COE. And like, yeah, I've been in education. I've been around education a lot of my career as a therapist and consultant, but like in deeply rooted in education, so much of what is said, I always cocked my head, sort of like my German Shepherd does, and go, well, what does that actually mean, though? Like, how do you, like, I hear your words. I hear that blending and braiding funding is really important, and it makes a lot of sense. Um, but I think over the past 5 years, it has become a little more tangible. So I'll just walk you through sort of what the process has been like here at Butte County. And it really began with the campfire in 2018. And that was really the impetus of a whole lot of things, right? So I think the first step in how we thought about blending and braiding funding was we needed to have the mental models that supported the need for school-based mental health funding, right? I think what's unique about rural environments is there's the assumption that everybody thinks this is a good idea, that we should be doing this on school campuses. For those of you who are in rural areas, no, it isn't. That is not uniformly believed. And so the first thing we had to contend with is a mental model. Well, when you have a natural disaster that wipes out basically two towns, you then have that paradigm shift. You sort of have the shift in thinking. So the first set of funding that we were really working with was philanthropy funds through the Butte Strong Fund. So this was a lot of the money that came from across the country. It came from Ken Grossman, who's the Sierra Nevada owner, and it was disseminated pretty freely because things needed to be done quickly. BCOE never really was in the game of direct service unless it was through the cell phone. So unless you were under special education, it really was not normal practice for the COE to embed direct service staff in LEAs for the purposes of mental health. That's sort of a new phenomenon. And well, it was then. So what we did was we just got anybody who either had a PPS, who had a license, or was an associate, and we just put them in front of students, and it was very Wild Westy. But our intent was how do we just embed services that are immediately accessible, either for crisis, either for short-term work, and then pass them on to more specialty mental health or more intensive services. Um, and we were partnering at that time with multiple LEAs because we were trying to serve all the students that funneled out of Paradise into different parts of the county, and we were working directly with Paradise. Um, Shortly after that, we were approached by our county mental health and started utilizing MHSSA funds to supplement a lot of that work, right? So in addition to using the Butte Strong Fund, this is where we really started in practice kind of blending funds. So we might have a clinician that is funded entirely by MHSSA. We might have another at another school in Paradise that is partially funded by MHSSA and the Butte Strong Fund. I think the most critical piece to blending and braiding funding is to have a future-oriented vision and to be able to look out 2 years, 3 years, 4 years. Because I think I started doing that right away and said, well, when does MHSSA sunset? After MHSSA, we had SB HIP funds. Those were a little more, they weren't restrictive, as many of you know. They were incentive money, but we used those a little bit differently, and they really didn't come into play until a little bit later. But those funds were used to create wellness spaces. There really wasn't a whole lot of blending and braiding. LEAs would blend SB HIP funds with LCFF or other funds that they had locally to build out the wellness center. But we weren't using those to blend and braid for our school-based mental health yet. Shortly after that, we applied for the bipartisan Safer Communities, Stronger Connections grant, and that grant was really designed. Hold time out. I need to time out because my wife's looking for a key. I have to put you on blast. It's in your purse.
Because where
It's
is
in
it?
your purse.
What?
It should be in your purse. I nailed it.
Wrong.
All right. This is what you get when I'm supposed to be off. What are you laughing at? This is life, man. I'll bring it right to your door. So the next thing that we did was we did the bipartisan stronger communities grant. So that was a very broad grant, and not a lot of county offices or LEAs applied for in California, comparatively to a lot of grants. And what we did was I sort of looked and I said, I know this thing called the fee schedule is coming. I know these things called wellness coaches are going to be there. Neither had been solidified or started yet. They were sort of working through all of their processes. And we just hired 10 wellness coaches, right? So we just said we're gonna use these funds to hire wellness coaches as a bridge to the fee for service and a bridge to HCI funding. Oh, that's the other type of funding I didn't include. I literally have a list of 10 things. Um, we did start weaving in and braiding those SCG funds, which paid partially for clinician time, but mostly just entirely for wellness coaches. And so we had some folks who were partially funded through MHSA and SCG. Again, what we were trying to look at from day one of the Wellness Coach grant was when was it sunsetting? Well, unfortunately, it's sunsetted at the exact same time as MHSSA, right? It's sunsetting at the same time as the CYBHI grant rounds, which were a little bit different. Um, and so what I tried to start thinking about was all of these funding streams are sort of drying up. What are the funding streams that are not? And especially when it came to implementing and sustaining wellness coaches. So we got on the CYBHI bandwagon very early. We were in cohort one. We were not in cohort one because we were gung ho to bill a bunch. We were in cohort one to be like, what is this? And how do we talk to our LEAs about this? And is this really something we want to do? So we were just dipping our foot in it. Um, and we started probably last year to weave in CYBHI funding, MHSSA funding, Stronger Connections grant funding to begin to sustain folks for the future. The last, well, it's not the last. The other piece of funding we used specifically for wellness coaches and clinicians was California Community Schools Partnership Program money. So we partnered with the LEAs. So part of what we're doing next year, right, is we have 8 wellness coaches that we have in other districts. If that district is involved with community schools, we have essentially an MOU that is a contract that is a bill back. So we will say, this is how much it costs for them. They dedicated those funds out of community schools. We're including a GAN. It's not supplanting because it never existed prior. We have a GAN that shows when the grant ends. We don't have to wait the 6 months. And whatever they're able to bill through CYBHI or through ECM, which is another part I'll talk about, we essentially take that off the invoice to that district at the end of the year, right? So instead of it costing 90,000 with PERS and everything, it probably will cost something like 40. And that comes out of their community schools money. So when I think about blending and braiding from the point of view of a COE, you're not just talking about your own COE funds. You're talking about the funds of those you're in partnership with. And I would recommend like those discussions started a year and a half before all of these grants sunsetted about like, what do you want to do? Is this a beneficial service for your students? Well, it is, especially for small and rurals, which a lot of them do not have a PPS person. They don't have any wellness. They don't have any wellness or counseling folks. So it's really critical. So we began those discussions early on. We also have a contract with partnership. We're just waiting to get trained, but we will also then carve out some time in our wellness coach for our wellness coaches to be able to do some ECM work. So 5 to 6 to 10 kids, right? That then brings in up to 5,000 a month per student, or I mean 5,000 a month total plus CYBHI. And we believe that model, once it really starts moving, fully funds those wellness coaches. And the LEAs we're working with, which are very similar to somebody who just spoke, they're single school LEAs, Bethany. It's very similar. Single school LEAs, one school, 60 to 110 kids. Um, and we believe through that model, it will cost them nothing, nor do they have to hire and supervise them. We do all that. So part of blending and braiding is about what role does your COE want to play? What is it appropriate? Is it appropriate to go to a small 1,500 student district and have them go through the process with partnership and then in the future have to have the capacity to manage that relationship? We don't believe it is. We don't believe it's possible. I mean, they could, but most probably can't. So part of blending and braiding has been what role do we play? How do we, because the COE sometimes has a little more time to look at these things, combine all of these funds? We were lucky enough that SCG, we spent all our money. I think we might have been the only one in the state that spent our grant money. So we got an additional $300,000. We spread that through all of our wellness coaches, and that tax off even more off of what those districts will owe us, right? The last thing we're doing is what Sac County did, the Federally Qualified Health Center partnership. We partnered with Tribal Health though. And that I believe is, if I were recommending to folks what you do that before you do a county FQHC. The rates are, I can't say them public, they're higher. So whatever in CYBHI you get for psychotherapies is like 3.5 times more. And that's per encounter. So you're looking at, if you can partner, you should partner with your tribal health center because it's already increased that partnership we have with that community in a way that not much else that we could have done would. So now we really have this sort of like Mike Lombardo's Excel spreadsheet. Like we have that. We don't use that in particular, but we have that. We have these funding streams, some of which are being pruned off because they're no longer in existence. But we're looking at the others, and the one in the middle is the FQHC. Right next to that is CYBHI. And then ECM is right next to that. And if you think about them as circles, FQHC is the biggest circle because it generates revenue. That revenue can be used to sustain wellness coaches. It can be used to expand the program. So that's just kind of how we have thought about blending and braiding funds. I don't know that we had a master plan. We just reacted. But those are kind of the pots of money that we're working with right now and how we're shuffling them around.